So hello everyone, welcome to our Faces of Autism interview, and this week we've invited a very special guest, Dr. Heather Henderson. So Dr. Henderson, would you like to introduce yourself?
Sure, thank you. Thank you for inviting me to speak with you today. My name is Heather Henderson. I'm a professor and the chair of the Department of Psychology at the University of Waterloo. My research area is developmental psychology and specifically children's social relationships. We do studies in my lab of how children interact with each other, and we're really interested in individual differences with a focus on children who struggle, who are either shy temperamentally or have, for other reasons, struggle to connect with other kids. I teach courses in the area of developmental psychology, both at the undergraduate level and supervise graduate students and teach at the graduate level as well.
Awesome. Well, let's get right into the interview.
Okay.
So our first question is, tell us about your work and your research interests and how you got into autism research.
Sure. So my work started out as a graduate student studying child temperament, which is really the beginnings of child personality. And I was particularly interested in childhood shyness. I found shyness really interesting because it's a perfect example of nature and nurture working together. So shyness is one of the most heritable traits that children have, and it runs in families, and it's one of those traits that just varies across every population of humans. And a lot of people pathologize shyness, and in my lab we're really interested in understanding that full range of behaviors and taking away some of the stigma about people who have more difficulty interacting with others. In my first faculty position, I worked at the University of Miami in Florida for 12 years. The Department of Psychology was in a building with shared space with the Center for Autism. And at the end of a lot of talks I gave about shyness, people would ask me how we knew the difference between shyness and autism. And that really got me thinking about where there are points of overlap and where there are points of real difference between just normative temperament traits and a neurodevelopmental disorder like autism. So we started doing a series of studies comparing children with autism with typically developing children to look at ways they were similar and ways they were different.
Amazing. And yeah, tell us about your work in the Social Development Lab at U Waterloo and how you address the needs of children with autism.
Yeah, our work right now at Waterloo is really focused on the normative shyness development, but I think the implications of a lot of our work goes way beyond that. One of the things that's unique about the work that we do in our lab is that almost all of our studies are what we would call an observational design. So when people study social development, often they rely on parent reports or self-reports, or people fill out questionnaires about their personality and about their social behavior. We've really committed to doing studies where we observe children's behavior. We have found it's really hard for parents to report on their kids' social behaviors, especially as they get older and into adolescence, as children spend less time with their parents. Most of their social interactions are happening outside of the home, and so it's hard for parents to really know what kids are like when they're interacting with other kids. So we have a lab upstairs in the past building that is equipped with cameras and a microphone and a one-way mirror where we can record children's live interactions with each other. And then we do a lot of coding of their emotions, of the way they speak, of the way they interact, to try to quantify differences in behavior. That is slow research. It's hard research to do. It relies a lot on the goodwill of families in our community to come in. But we time and again find it such a rich source of data, and it is real human behavior, and that's what really motivates us.
Awesome. And in your paper, Meta-Perception in Adolescents with and Without Autism Spectrum Disorder, it was found that adolescents with autism exhibited more accurate meta-perceptions than neurotypical adolescents. Yeah. So what is the significance or implications of this finding?
Yeah, this was a paper we published. My graduate student, Lauren Usher at the University of Miami, this was part of her dissertation study. And I loved this study. So what we did here is we did an observational study where we brought in adolescents who either had autism or did not have an autism diagnosis, and we paired them up and observed them in a social interaction. At the end of that social interaction, we asked each of the partners to fill out a measure about what they thought about the other child. They had just met. It was the first time they had met. But at the same time, what they thought the partner thought about them. That's what we call meta perceptions. So it's both what I think about you and what I think you are thinking about me. What Lauren found in that study, that on average, teens were not very good at predicting what the other person was thinking. But what we found interesting is that the participants with autism were actually slightly more accurate in those perceptions, in their meta perceptions, than the participants without autism. So there's a lot of ways to interpret that, and we're really not sure. One is that the teenagers with autism were paying more attention to the signals they were getting from their peer during their interaction, and actually were encoding that and making accurate predictions. The flip of that could be that the neurotypical teens were giving clearer signals about how they felt about the child with autism, how much they liked them, how much they enjoyed the interaction. So for example, we think they were expressing more emotion. We think that they were speaking in a way that really gave clues. And so it could be the other way around, that the neurotypical adolescents were giving clear social cues that were easier to interpret. And in contrast, the adolescents with autism were giving less clear cues that were harder for their new social partner to understand. And we're really interested in what we would call that dyadic effect. So not just what I understand from you, but what cues you're giving me to understand. And that's driven a lot of our work. Since we did that study, every time we do an observation study, we gather that same measure about perceptions and meta perceptions, because we think it's really a critical human ability to accurately interpret what other people think about us, because we use that to change our behavior in a way that optimizes the quality of our interaction and the likelihood that we'll form a good lasting relationship. So that was our first study, and Lauren was the one who designed that measure that's getting used in our lab and many other labs at this point as well.
Wow, yeah, that's really innovative and awesome research that you guys are doing.
Thank you.
Yeah. And finally, as a professor, researcher, and advocate, what do you think people should know or understand better about autism?
I think that's a really good question. Again, my interest is really in interpersonal relationships, and I reflect back to your very first question about what motivated me to think about autism and study autism. And the common assumption when people ask me, how do you know that shy kids don't just have autism? I think the common assumption and stereotype is that individuals with autism don't care to interact with others or don't care about forming close interpersonal relationships. And every single piece of data that we've gathered suggests that's not the case. So every single piece of data that we've gathered when we think about traits and normally distributed, there's as much variability and shyness and sociability in a sample of kids and teenagers with autism as there is in a sample of kids and teenagers without autism. So we see people with autism who are desperate to interact and form close interpersonal relationships, and we see kids with autism who aren't as interested in forming those connections. But that's no different than what we see in kids without autism. And so I think for me, what I want people to understand is there's as much variability among children with autism as there is in children without autism, in terms of their social motivations, in terms of their social skills and their desire to connect with others. And just to keep that frame of reference in mind and not make assumptions that people with autism, because they present slightly differently, they may not follow cues in the same way, that does not mean they don't care to form social relationships. And I think that's what really matters to me.
Well, thank you so much, Dr. Henderson, for interviewing with us.
You're welcome.